syndrome. Imagine you've had the flu for about 4 days. Fever, muscles, aches, the whole thing. You figure it'll pass. Then one morning you wake up and something feels different. Your chest is tight. You take a deep breath, but it doesn't feel like enough. You try again harder this time, and it still feels like the air isn't reaching where it needs to go. Within a few hours, you're coughing, gasping, and no matter how hard you breathe, your body is starving for oxygen. This is hantavirus pulmonary syndrome, and it starts with something as small as a mouse. The deer mouse, specifically. If you happen to sweep out a shed, clean a cabin, or disturb an area where infected mice have left behind poop, urine, or saliva, the tiny particles can float into the air, and then you breathe them in without even noticing. The virus lands deep in your lungs, infects the cells there, and then spreads through your bloodstream to the walls of your lungs' tiniest blood vessels. For the first 3 to 5 days, it feels like nothing more than a bad flu. You get a high fever, painful aching in your thighs, hips, back, and shoulders, and your whole body feels heavy. Most people go to the doctor during this phase, get told it's probably nothing serious, and go home to rest. And the reason it gets so bad so fast is because of what the virus has been doing to your blood vessels this whole time. Most viruses that attack blood vessels do it by ripping them apart. This one doesn't. Think of the walls of your blood vessels like a brick wall held together by mortar. What this virus does is dissolve the mortar. The bricks are still there, but now there are gaps between every single one of them. So now the liquid part of your blood starts leaking through those gaps and pouring into your lungs. In the worst cases, up to 8 liters of fluid can flood in and around the lungs, piling up at a rate of up to 1 liter per hour. And it's not just your lungs that are giving out. The virus goes after your heart too. When doctors examined the hearts of patients who didn't survive, they found the virus had gotten inside the heart muscle itself and started damaging it from within. So while your lungs are flooding and you can barely breathe, your heart is also getting weaker and weaker, losing its ability to pump blood. And once both your lungs and your heart start failing at the same time, it can go fast. In the most severe cases, patients die within 1 to 2 days after the lung flooding begins. As of 2026, there's no vaccine for hantavirus. There's no drug that can treat it. If you catch it, all doctors can do is put you on a ventilator, try to keep your blood pressure from collapsing, and hope your body is strong enough to fight it off on its own. Polio bulbar.